8 early warning signs of breast cancer. Did you know that 1 in 8 women will develop breast cancer in their lifetime? Breast cancer is often called a silent disease because many symptoms go unnoticed until the cancer has progressed. Unfortunately, when it's caught in the later stages, treatment becomes more complicated and survival rates drop significantly. Stick with me until the end because knowing these signs could save your life or the life of someone you love. So, how does breast cancer even begin? It starts when cells in the breast, often in the milk ducts or glands, begin growing uncontrollably. Normally, your body has a system to keep these cells in check. They grow, divide, and eventually die when they're supposed to. However, when genetic mutations occur in the genes that control this process, these cells don't follow the normal rules. Instead, they continue to grow unchecked, forming lumps or tumors. But take note, not all lumps are cancerous. Some may be benign and harmless. However, if cancerous cells break away from these tumors, they can spread to other parts of your body, making the disease much more difficult to treat. There isn't a single cause, but several risk factors contribute to its development. Genetic mutations. Inherited mutations in genes like BRCA1 and BRCA2 can significantly increase the risk. Hormonal factors. Extended exposure to estrogen, such as starting menstruation early or entering menopause late, may contribute. Age. The risk increases with age, particularly after 50. Family history. Having close relatives with breast cancer raises your risk. Lifestyle choices. Obesity, lack of exercise, smoking, and heavy alcohol consumption can increase the likelihood. Radiation exposure. Previous radiation therapy to the chest area may increase risk. Reproductive history. Not having children or having a first child after 30 can increase the risk. Now, let's break down the 8 early warning signs of breast cancer in detail. A lump or thickening in the breast or underarm. A lump is one of the earliest and most common signs of breast cancer. It may feel like a hard pea or a knot under the skin. Keep in mind, not all lumps are cancerous, but it's important to have any lump checked by a doctor as soon as possible. Changes in breast size or shape. Have you noticed one breast becoming larger or shaped differently than the other? Sudden changes in size or shape, especially if they're not related to your menstrual cycle, could indicate something isn't right. Dimpling or puckering of the skin. Does the skin on your breast look like an orange peel with dimples or a rough texture? This can happen when cancer cells block lymphatic vessels under the skin, causing changes in its appearance. Nipple changes. Watch for any changes to your nipples. Are they pulling inward when they didn't before? Is there an unusual discharge, like blood or a clear fluid, that you weren't expecting? Redness or flaking around the nipple can also be a warning sign. Remember, not every sign of breast cancer is painful. Many early symptoms can be subtle or painless, which is why routine self-checks and medical exams are critical. If you found this video helpful, please give it a like, share it to someone who needs it, and subscribe for more health tips every week. Pain in the breast or underarm that doesn't go away. Occasional breast pain might be normal, especially around your period. But pain that lingers, especially in one area of the breast or underarm, should never be ignored. It could signal an underlying problem. Swelling in all or part of the breast. Even if you don't feel a lump, swelling of all or part of the breast could be a sign of breast cancer. Sometimes, this swelling can make one breast feel heavier than the other. Do you have any of these symptoms so far? How old are you right now? Let us know in the comments. Redness or warmth in the breast. If your breast looks red, inflamed, or feels unusually warm to the touch, it might be due to an infection. However, it can also be a symptom of inflammatory breast cancer, which is a rare but aggressive form of the disease. Visible veins on the breast. Are you noticing veins on your breast that are more prominent than usual? This can happen due to a tumor growing and putting pressure on blood vessels. While not common, it's something worth checking out with your doctor.